Time is so precious, and that's why we're so grateful. She shares it with us. So this morning we'll go to the Guam Memorial Hospital with the very latest hospital administrator, Lillian Posadas, standing by. Good morning, Lillian.
Good morning. Good morning, Jason. Good morning, Chris. Good morning, Sabrina.
Good morning.
Jason. Good morning, Bob.
Good morning, Guam. And is it a good morning, Lillian at the Guam Memorial Hospital? What's the latest with the COVID census?
Well, it is, in a way, we have a little bit of some breathing room. Our census this morning is at 43. And of the 43, 7 of them are at the ICU level of care. And of the 7, 4 of them are on ventilator support. And up at the SIF, there are 7 individuals transitioning, getting ready to go home or getting ready to go to the ISOFAC. So the numbers are going down, which is hopeful, and that, it continues to go down. But we're still kind of concerned that, with the Thanksgiving this week, there may be some, celebrations, family celebrations. And so we're anticipating that perhaps the numbers will go up next week.
Are you still getting any of the construction workers or any more inmates hospitalized there, Lillian?
Fortunately, no, which is a good sign that hopefully they are keeping them isolated in their own facilities. And some of them, I think, have already been cleared. They've met the time and the criteria that they're no longer contagious, they're no longer infectious. And so they've been cleared by public health.
Have you guys been able to administer the bamlanivimab?
Yes, ma'am, we have. We administered the second dose yesterday. So an individual came into the emergency room, met the criteria, was given the transfusion of the antibody and discharged home, and no reaction, no adverse effects at all. We also administered the first convalescent plasma transfusion. I believe it was yesterday, and for an inpatient, and no adverse reactions. And so, yes, that's right. There's progress that, we're using these tools, hopefully to mitigate, this COVID, and to help individuals from, getting further into the acute and severe condition of the COVID. So, yes, we're putting them into use.
So the second dose was yesterday. What about the first dose?
The first dose was, I believe, Friday. Friday was the first dose of the bamlanivimab, and the individual was discharged to the ISOFAC. And so the second dose was yesterday. The individual was discharged home. So, again, it looks really, really hopeful.
Do you have the ages for the 3?
Oh gosh, I don't have that right off the bat.
But
Ages. Back to you.
But again, this is for patients that test positive that fit a certain criteria. For example, if they have comorbidities, but
the risk factors, right, such as diabetes. If they have those risk factors that then, that puts them at a high risk to be really, really sick, they met that criteria. Plus the test was just within the 10 days, because when they came into ER, they were tested. And so right in there, when they tested positive and they met the other criteria, they were given the antibody transfusion.
And I guess the goal really is to HHS distribute this all across the country to areas where there were, I guess, an increase in like hospitalizations and COVID case count. And so they're trying to
to prevent them from getting
being hospitalized. Yeah.
Right, to prevent them from getting to that acute stage where they need to be hospitalized. So, yes, that's the whole goal of that, so that they have that infusion of antibodies to help them fight the infection.
Lillian, did you say how many of the 7 receiving the ICU level care are on the ventilator?
Yeah.
4 of them are on ventilator support.
And then we had 5 deaths since Friday, right?
You know what? I lost count how many, but I believe the last one was it Saturday? Friday or Saturday.
Have we had any additional deaths since that last one that was reported?
None that was reported to me.
How about transmission of the virus with the hospital staff? Have we had any more staff members test positive since the last time we spoke?
I just texted our infection control nurse and I haven't gotten a response, but there was one individual who tested positive, and I believe Friday was when it happened. So that individual is in isolation.
Any of the vials of Bamlanivimab given to GRMC?
Yeah, we did. I mentioned it Friday that we gave them, we received a shipment of 50, and so half of that we gave it to GRMC.
Have you heard whether or not they've administered the?
I haven't.
Okay.
Yeah, I haven't heard, and I've asked the nursing supervisor, and they haven't heard either. So we'll reach out to GRMC to see if they were able to administer it.
And since they were given these files, wouldn't they have to report it to GMH so that you could put it in your reports to HHS?
Either they report it to us or they have their own, they're supposed to be reporting their own data through the HHS teletracking portal.
Mm-hmm. And is there any, I know we only got the 50, would we be getting any more, or?
They will give us an allocation on a weekly basis depending on the usage of it and our numbers.
Mm-hmm. Okay. But so you haven't heard whether or not you have to wait till you use all 50?
We haven't heard that at all because they go by our daily data that we submit every day.
We do have a question here as to whether or not you may or may not know if Naval Hospital got any of these Bamlanivimab.
Call it Banlam. Just so it
Bamlan.
say Banlam. Yeah, I haven't heard anything that the Naval Hospital got, but I'm sure they probably, would have gotten some.
Okay.
So I just haven't heard any communication from Naval Hospital.
Okay. Any new staff arrive?
Not over the weekend. We lost a couple to emergency family situations in the mainland. So a couple of them had to go back to the mainland. But we didn't receive any new staff over the weekend.
Have any of the staff that came here to help us with COVID caught COVID here?
There were a few in the beginning when they, I guess with their travel or their test results that they got negative, may have been over the 5 days. And so part of the pre-employment was to test them. And I think 2 or 3, that was part of the pre-employment process. So I think 2 of them in the beginning or 3, but none since, not recently.
Thank you, Lillian, for your time. Anything in closing here? Did you hear the CDC is we're now level 4, very high risk of travel. They're basically saying stay away from Guam.
Well, stay away from travel is what they're saying at the national level.
Right, yeah.
People continue to travel. The Arizona airport, there were lots of people at the airport. So, we can say that, but as long as they're exercising the precautions of masks, I guess we can't stop people.
Lillian, what would you say to people who look at the hospitalizations? I mean, I want to say we went as high as 80 at one point, right? Down to 50. People looking at these hospitalizations saying, oh, there's only 50. We're beating the virus.
Like I said, we can't keep our guards down. We can't let our guards down. We really still need to continue this fight because we don't want it to go up again. We don't want it to go up in the 80s and 90s. We don't want to see anybody die anymore, We don't want to lose lives anymore. We want to keep everybody protected as much as we can.
Thank you, Lillian.
Okay. Thank you, too.
Appreciate your time. Be safe, okay?
Happy Thanksgiving.
I'm sorry we don't have anything in the Zoom room this morning. We're saving up for Thanksgiving.
Okay.
So come on Wednesday. We'll have a nice virtual spread for you.
All righty. I'll be there.
Okay, Esther. Okay, right. You're one of our 5. You're one of the luck. You won the raffle. Yeah, Jay. Oh, hold on. Yes, sir.
Well, speaking of an amazing spread.